In ancient China, there was a saying among doctors that survived for thousands of years. No herb cabinet is complete without ginger. They called it the universal medicine. And for 5,000 years, it was prescribed for everything from nausea to inflammation to muscle pain to heart problems. When Ayurvedic healers in India heard about it, they had their own name, a chest of medicines in one root. Ancient Greek physicians ate ginger after large feasts to settle digestion. Roman traders paid fortunes to import it across dangerous trade routes. Confucius reportedly never ate a meal without ginger. 5,000 years, 3 continents, countless healers across dozens of civilizations, all reaching the same conclusion about this knobby, unassuming root. And today, most people use it as a garnish or throw a tiny bit into a stir-fry. They have absolutely no idea what they're leaving on the table. What their grandmothers knew instinctively, modern science has now proven with hundreds of peer-reviewed studies. Here's what's even more frustrating. The people who do try to use ginger for health often use the wrong form. Dried when they should use fresh. Cooked when they should use raw. They're destroying the active compounds, the gingerols and shogols, before they ever reach their system. I'm going to show you what 5,000 years of medicine knew, and what modern research has now confirmed with hard data. Benefit number 6 about natural pain relief completely changes how you think about reaching for the medicine cabinet. Quick question: do you use ginger regularly or just occasionally? Drop daily, sometimes or rarely in the comments. I read every single one. Let's dive in. Number 1. Settles nausea better than medications. Let's start with the benefit that has the most dramatic research behind it. If you've ever experienced nausea from pregnancy, motion sickness, chemotherapy, or surgery, this changes your life. A 2012 clinical trial published in Supportive Care in Cancer, involving 576 chemotherapy patients, found ginger significantly reduced nausea severity. Multiple studies have shown it works as well, or better than Dramamine for motion sickness, without the drowsiness. For pregnant women dealing with morning sickness, research published in multiple studies found ginger safe and effective, with significant improvements reported in nausea and vomiting symptoms. The compounds gingerol and shogaol work directly on serotonin receptors in the gut, the same receptors that pharmaceutical anti-nausea drugs target. Nature got there 5,000 years before the pharmaceutical industry. For nausea, chew on fresh ginger or drink strong ginger tea. Start with small amounts, about a half-inch piece of fresh root. Nausea eliminated. But what happens in your digestive system goes far deeper than just settling your stomach. Number 2. Transforms your entire digestive system. Confucius never ate a meal without ginger. Ancient doctors prescribed it before feasts. There's a reason digestion and ginger have been linked for millennia. Ginger stimulates saliva, bile, and gastric enzyme production. It speeds up gastric emptying, meaning food moves through your system more efficiently instead of sitting and fermenting. A study in the European Journal of Gastroenterology and Hepatology found ginger accelerated gastric emptying time significantly in healthy volunteers, reducing the half-emptying time from approximately 27 minutes to 13 minutes. If you experience bloating, gas, or that uncomfortable feeling after meals, ginger addresses the root cause. It's not masking symptoms. It's actually improving how your digestive system functions. Imagine finishing a large meal and feeling comfortable instead of sluggish and bloated. That's your digestive system working the way nature designed it. Digestion optimized. And when food moves properly through your system, it creates a cascade effect throughout your entire body. Number 3. Fights chronic inflammation systemically. Here's something most people don't realize. Chronic inflammation is behind almost every major disease: heart disease, diabetes, cancer, Alzheimer's, arthritis. It's like a slow fire burning inside your body that you can't see or feel directly. Gingerols, the active compounds in fresh ginger, are powerful anti-inflammatory agents. Research published in the Journal of Medicinal Food found that ginger inhibits multiple inflammatory pathways simultaneously. It blocks COX-2 enzymes, the same target as pharmaceutical anti-inflammatories, plus additional pathways that drugs don't touch. Studies have found that ginger extract reduces inflammatory markers significantly in participants with metabolic conditions. Unlike NSAIDs, ginger doesn't damage your stomach lining or strain your kidneys with long-term use. Inflammation reduced, and this leads directly to one of ginger's most impressive benefits for anyone dealing with chronic pain. Number 4. Relieves muscle pain and soreness. Whether you exercise, do physical labor, or just wake up stiff and sore, this benefit matters. And the research is remarkably consistent. A study published in the Journal of Pain had participants consume 2 grams of ginger daily for 11 days. After performing exercises designed to cause muscle damage, those taking ginger experienced 25% less pain than the control group. The effect isn't immediate. Ginger works cumulatively over several days, but the benefit builds and persists. For athletes and active people, this means faster recovery and less downtime between training sessions. Real quick, if you're learning something useful, hit that like button. It helps more people discover this information. Takes 1 second. Muscle pain reduced, but the pain-relieving power of ginger extends to an even more stubborn type of pain. Number 5. Eases menstrual pain significantly. This benefit transforms life for millions of women. Menstrual pain affects up to 90% of women at some point, and many suffer silently because they think nothing natural actually works. Research comparing ginger to ibuprofen for menstrual pain has shown ginger works comparably to the pharmaceutical, with none of the side effects on stomach, kidneys, or liver. Dosages in successful studies range from 250 milligrams of ginger powder taken multiple times daily during the first 3 days of menstruation. Menstrual pain managed. Now let's talk about the benefit that shocked researchers studying osteoarthritis. Number 6. Relieves joint pain without drugs. This is the benefit I mentioned at the start, and the research keeps getting stronger every year. Arthritis affects approximately 53 million Americans, and that number keeps growing. Most people manage it with non-steroidal anti-inflammatory drugs like ibuprofen or naproxen that slowly damage their stomach lining, strain their kidneys, and increase cardiovascular risk over time. A landmark 2001 study published in Arthritis and Rheumatism followed 261 patients with knee osteoarthritis for 6 weeks. Half received ginger extract, half received placebo. Those taking ginger experienced significantly less pain, improved mobility, and required fewer rescue pain medications than the placebo group. The effect was consistent, measurable, and clinically meaningful. A meta-analysis confirmed these findings across multiple studies. Ginger consistently reduced pain scores and improved physical function in osteoarthritis patients. The effect built over several weeks of consistent use. Imagine climbing stairs without wincing, getting out of bed in the morning without that first agonizing step, opening a jar without pain shooting through your hands. That's possible with consistent ginger use over several weeks, and unlike NSAIDs, you're healing rather than just masking symptoms. The 3 mistakes destroying your results. Before I give you the final 4 benefits, let me save you from the mistakes that waste most people's efforts with ginger. Mistake number 1, using only dried ginger. Fresh ginger contains gingerols, the most potent anti-inflammatory compound. When ginger is dried, gingerols convert to shogols. Both are beneficial, but they have different strengths. Use fresh for nausea and acute inflammation, dried for digestive support. Mistake number 2, cooking it too long. High heat destroys the beneficial compounds. Add ginger at the end of cooking, or consume it raw for maximum benefit. Those stir fries where ginger cooks for 20 minutes? You're getting flavor but minimal healing power. Mistake number 3, not consuming enough consistently. Most benefits require 1 to 3 grams daily for several weeks. A tiny slice in your tea once a week won't do much. Consistency matters more than occasional large doses. Now let's finish with 4 more benefits that complete the picture. Number 7, supports heart health. Ginger lowers blood sugar, reduces cholesterol, and acts as a natural blood thinner, all factors in heart disease prevention. A 2018 study found that 2 grams of ginger powder daily significantly reduced fasting blood sugar in type 2 diabetics. Research in the Saudi Medical Journal showed ginger's blood-thinning effects rival pharmaceutical options for preventing dangerous clots. If you take blood thinners, consult your doctor before adding significant ginger to your routine. Heart protected, and this blood flow improvement connects to a benefit that surprises many people. Number 8. boosts brain function. Here's something fascinating. The anti-inflammatory and antioxidant compounds in ginger don't just help your body, they actually cross the blood-brain barrier and protect your brain directly from oxidative damage and inflammation. A 2012 study published in Evidence-Based Complementary and Alternative Medicine tested ginger extract on 60 middle-aged women for 2 months. Those taking ginger showed significantly improved working memory, attention, and cognitive processing speed compared to the placebo group. Their brains were literally functioning better. Animal studies suggest ginger helps protect against age-related cognitive decline and helps prevent the brain changes associated with Alzheimer's disease. While more human research is needed, the mechanism makes biological sense. Reduce inflammation and oxidative stress in the brain, and the brain functions better. Number 9. Fights bacterial and viral infections. There's a reason your grandmother made ginger tea when you were sick. And there's a reason that tradition survived across cultures for thousands of years. Modern research confirms what grandmothers always knew. Studies show that gingerol inhibits bacterial growth across multiple pathogen types, including bacteria that cause respiratory infections and the pathogens responsible for gum disease. Research published in the Journal of Ethnopharmacology found fresh ginger extract effective against RSV, respiratory syncytial virus, and shows promise in preventing and treating respiratory infections. At the first sign of a cold or respiratory symptoms, strong fresh ginger tea with raw honey helps your immune system respond more quickly and effectively. Prevention is always easier than treatment. Number 10. May help prevent certain cancers. This research is preliminary but promising. Laboratory studies show 6-gingerol, the main bioactive compound in fresh ginger, has anti-cancer properties against colorectal, gastric, ovarian, and pancreatic cancer cells. Population studies show lower cancer rates in cultures with high ginger consumption. This isn't a cure, more research is needed. But as part of an overall healthy lifestyle, ginger's antioxidant and anti-inflammatory properties offer protective benefits. Which benefit surprised you most? Drop it in the comments. I genuinely want to know what resonated with you. If you've made it this far, subscribe and hit the bell. I put out research-backed health content like this every week. How to actually use it. Here's your practical guide for maximum benefits. For digestive support, chew on fresh ginger or drink strong ginger tea 15 to 20 minutes before meals. This primes your digestive system before food arrives. For pain and inflammation, consume 2 to 4 grams of fresh ginger, about a 1-inch piece, or 1 to 2 grams of dried ginger powder daily. The key is consistency. Give it at least 2 to 4 weeks to build up anti-inflammatory effects. Most studies showing pain benefits ran for 6+ weeks. For nausea, chew small pieces of fresh ginger or drink strong ginger tea at the first sign of queasiness. For motion sickness, take it 30 minutes before travel. To make truly effective ginger tea, slice 1 to 2 inches of fresh ginger root thinly. Simmer, don't boil, in 2 cups of water for 10 to 15 minutes. The longer it simmers, the stronger and more medicinal the tea. Add raw honey and fresh lemon if desired. Drink while warm. Important: if you take blood thinners like warfarin or Coumadin, diabetes medication, or have gallstones, consult your doctor before consuming large amounts of ginger regularly. Ginger enhances the effects of these medications. 5,000 years, 3 continents, countless healers across dozens of civilizations, and now hundreds of modern peer-reviewed studies confirming exactly what traditional medicine always knew about this humble root. Here's the truth I want you to take away. Ginger is genuinely powerful, but it works best as part of a complete approach to health. It addresses inflammation and digestion beautifully, but your body needs support from multiple angles to truly thrive. There's one ancient remedy that healers have called the cure for everything except death for over 3,000 years. It was literally found in King Tut's tomb, preserved and ready for use. Modern research has published over 650 peer-reviewed studies on it, and it works through completely different pathways than ginger, meaning they complement each other perfectly. In my next video, I'm breaking down the 10 biggest black seed oil benefits you've been missing for years, and exactly how to use it right. When you combine the anti-inflammatory power of ginger with what black seed oil offers, you're creating a foundation that addresses health from multiple directions simultaneously. Click that video now. I'll see you there.